Hello, I'm Dr. Jason Scappa, and I'm a Southern California pathologist practicing at a community hospital operated by a large national healthcare system. Today I'm going to talk to you about how we use digital pathology to view our cases from home or another off-site location. Although we use glass slides every day when we come into the hospital, having a whole slide digital scanner allows us to view our cases remotely, apply image analysis software, share these cases with our clinical colleagues and patients, and archive the interesting cases for later use. Today, I'm going to show you how I go from practicing here in my work office in the hospital to here, my home office. Before we start viewing cases digitally, it's important to remember that any viewing of digitally scanned slides is done in a safe and secure format using the latest guidelines from both CLIA and HIPAA. If you are going to be signing out the cases exclusively based off what you see on the digitally scanned slide, it's important to adequately validate both your system and scanner. Guidelines on how to do this can be found at the cap.org. I also want to acknowledge that this is my institution's workflow operations. Yours may be different, but the general principles still apply. The main steps are 1. Logging onto a secure VPN. 2. Logging into your institution's secure website or intranet. 3. Opening and logging into your image viewing software. 4. If you are going to be writing reports or looking at patient charts, then opening your report writing laboratory information system and/or electronic medical record. 5. View your images and arrive at your diagnostic interpretation. 6. Lastly, when you're done, please make sure to log out securely out of all the systems. The first step I do is log into my virtual private network or VPN. This software is usually provided by your institution. Some institutions may have two-factor authentication requirements that send a ping to your mobile phone for credentialing in. Here, I accept the two-factor login on my phone and the VPN is launched and ready to go. Now that I'm inside my institution's network, I can access the same client programs I use at work for the LIS, EMR, and Image Viewer. Our institution has most of these programs on an intranet page that can be launched by a Citrix client. Once I have all the programs set up in my workspace, it's time to log into the Image Viewer. For these cases, I ordered in our LIS for them to be scanned by our laboratory technicians at our offsite regional laboratory. Once I arrive at my diagnosis, I write directly into our report writing LIS software and it's ready for sign out. Again, if you plan to actually sign out exclusively from this whole slide image, make sure you have done the appropriate validation and are operating under the current CLIA guidelines or waiver for remote sign out. It's important to remember that when working remotely, that you are still vigilant about protecting patient privacy. Now that I have reviewed all my cases, I am ready to close all the programs and securely log off. As you can see, viewing slides remotely allows you to view cases from anywhere in a safe and convenient way. If you would like more information on whole slide imaging or remote sign out, please visit the cap.org. There you can find guidelines and frequently asked questions. Thank you so much for joining me at my home office today.